Good morning, and welcome to the Health Science Career Choice Virtual Panel Discussion. Today, you will be hearing from professionals in the field and have an opportunity to ask some questions. We hope these discussions will give you an insight into the field and help you make informed choices about the careers that you are thinking about pursuing and the pathways you should consider to get there. Before we begin, here are a few webinar tips to share. To interact with the panelists and moderator, submit a question through the Q&A feature that is found in the controls at the bottom of your screen. You can submit a question anonymously if you would like, but if you include your name in the submission, we'll give you a shout out before your question. You cannot interact with other attendees through the webinar. The chat feature has been disabled and only our staff members can view your questions that are submitted through the Q&A. Students participating in the full panel discussion today will be entered into a $50 Visa gift card drawing. If you are participating as a whole class, don't worry, we'll be reaching out to your teacher for a list of those student names. If you need technical assistance, please call the help desk at 434-766-6772. And now, without any further delay, I would like to turn things over to the discussion's moderator, Dana Wilson.
Thank you so much, Adia. Thank you everyone for joining us in the Health Science Career Choice panel. My name is Dana Wilson. I am the Work-Based Learning Program Coordinator at the Institute for Advanced Learning and Research. What we are going to do is have our panelists introduce themselves, then I'll ask some questions for a bit of time, and then we'll take some student questions. So out of the gate, we have Brian Bradley from Sovah Health, Jennifer Canada, the Community Health Worker Program with Gateway Health, and Karen Oakes from Averett University School of Nursing. So if we could go in that order to introduce yourselves, tell us a little bit about what you do, maybe give us your title and tell us about your place of business. And we'll start with Mr. Bradley.
Hi, thank you. I'm a registered nurse. I'm also the chief nursing officer at Sovah Health in Danville. I work in administration and I lead a group of leaders that provide direct patient care to our inpatients here at the hospital in a variety of different settings, and really looking forward to this conversation with some new students.
Hi, my name is Jennifer Canada. I'm a certified community health worker with Gateway Health, and basically my career, we advocate for our clients, people with health conditions, between the doctors and the counselors and different kind of fields to help their health.
Good morning, everyone. My name's Karen Oakes. I'm here at Averett University. I am a registered nurse. I have my master's degree, and I'm also a nurse practitioner. So if anyone has any questions about nurse practitioner, I'd be happy to answer that too. So I work as a nurse practitioner on Mondays at the Wound Care Center at Sovah. And then I teach nursing here at Averett Tuesday through Friday. And my teaching responsibilities include our simulation lab. And if y'all would like to see that, you can go on our Averett site. And we have a really neat tour that you can look and watch some students in action. We had like a mock code, so it's pretty cool. And I'm really happy to see so many students. That number 152 minus us, that's a pretty big number, yay.
Yeah, that is. And you know, some of those numbers are actually classes full of students. So you have even more than what you think you do on the line, which is really great. Ms. Oakes, you had mentioned that you have a master's degree, and I know, Brian, you mentioned that you're an RN. So I'm curious about your backgrounds and how you got to where you are. And maybe if we could start with Ms. Canada, since we know a little bit more about the other two. How did you get where you are now? And did you take a traditional pathway, meaning did you go to college right out of high school, or did you follow a different path?
Actually, I didn't finish high school. I dropped out of school to raise my little sister and little brother. So I went back to school in 2009 to get my GED. And then the program was off. It was just like a footwork thing to see. We was noticing our community was falling We had so many health conditions. We had so many boundaries. We had so much stuff we had to overcome to change the health of our community. So we started this program in 2015, where we was just asking questions, seeing what the barriers was in different areas of our Danville. And then 2016, we initiate the program into different places like Gateway Health, the Institute, PATH, Life Saving Crew, the hospital, and it just started a career. So it
like
was
a
good.
build your own, choose your own adventure. I like it.
It was more like they was taking people who went through what people are going through,
Yeah,
to give them not only a chance to give back, but give them a chance to have a career to pass down to the rest of our kids and other kids, to show people that it ain't how you start a race, it's always how you finish the race. So
I love that. Miss Oakes, can you tell us a little bit about your background?
Yes, so some of you might be going to college, and that was the thing to do, go to college. And I did want to be a nurse just because of things that happened. My sister had surgery, and so a lot of people they think, oh, that's why they want to be a nurse. However, when I went to school, I was like, whoa, it's a lot of study, and the books were huge. And I thought, no, I don't want to do that. So I actually went through probably 4 different majors. I did psychology, and I didn't finish. I just took classes, and every semester I changed my mind until I finally decided, you know what, I do want to be a nurse, and I do want to put that time into being a nurse. So I started out, I switched my major a lot. So then my parents didn't want to pay for school anymore. So I worked as a nursing assistant, and that really, told me, yes, you want to be a nurse. And I had nurses champion me like, Karen, you can do this. You're smart. You got to spend time though. It's going to take a lot of studying. So I moved to Danville, Virginia. My husband's a physical therapist, and I was going to go to school in Greensboro, but they had a really nice school at the hospital. And I thought, oh, this is going to be the perfect school. But I knew I had to get my bachelor's degree. So I promised myself when I finished the diploma in nursing, so when you finish that, you can get a diploma, associate's, or BSN, and then you can take the boards, and then that's what makes you an RN. So I did the diploma. So in a way, you can say that's at the very bottom for education, but it's a lot of experience. And I'm going to be biased. I think we're the best nurses. But anyway, then I did do my BSN. I did that at ODU, and I worked at Sovah, and I loved it so much, and I loved teaching. And so I decided to get my master's in nurse education, and then I started teaching where I got my diploma. And then the school closed, and then they opened a program here at Averett, but I was not sure I'd get the job. So I thought, well, let me get my nurse practitioner. And so I did get a job at Averett, but then I already started something. I didn't want to quit, so I finished the MP. And I wish I could work all the time, because I love doing MP, and I love being a nurse educator, and I love being a nurse. So that's my story. I know it's crazy. And then just to add, when you teach at a university, they encourage you to get your doctorate. So I'm actually working on my doctorate right now too. And I will be finished in December of 2021. So that's about 8 months. I'm so excited. And I just want to tell all of y'all, I had teachers tell me, you're not college material. And so, if anybody's out there like that, if you want to do it, it takes a lot of work. But you can look at me and go, wow, so you can see I went up the ladder. I had to work my way up, but I did it. And so I'm super excited.
That's awesome. Thank you for sharing. Mr. Bradley.
Thanks. Yeah. So I did graduate from high school, but my traditional education from that point on it takes a different path. So the day after I graduated from high school, I went to a nursing home to get a job as a CNA. And I was fortunate to have somebody, an administrator, take a chance on me. And even though I was still 17, was able to become a CNA and started my career in nursing. And then I spent the next 7 years working on my RN, and it was a long path. I mean, most people after 7 years they're doctors, but I ended up being a nurse, and a lot of different steps along the way. I was an LPN first, and then I became an ADN. And I was fortunate to work in a hospital at that point that allowed me a schedule that I could work full time and go to school full time. As I was taking care of my family, I needed to do that. And right after I became an RN, I was very quickly a charge nurse, and I continued to progress and finished my BSN at another school. And at that point, one of my instructors actually was quite inspirational, and she worked in the ER at a level 1 trauma center in town in Tucson, Arizona. And as soon as she had an opening, I jumped at it, and just grew to love emergency room and trauma and intensive care. Really honed up my skills. But again, I was very quickly a charge nurse, and leadership opportunities kept coming my way. And so I wanted to learn more about the business of healthcare and that side of the fence. And so I ended up getting an MBA. So after a couple more years, I was an MBA, then I was a director, first in Tucson, and then I moved to Oklahoma City area. I was a director of an ER there, and just kind of progressed to an executive role, and now I'm in Danville.
That's amazing. You all have such unique backgrounds. I'm curious, what is one thing that you really love on a day-to-day basis you love about your job? We'll start with Ms. Canada here.
Well, on a day-to-day basis, I think what I love about my job is when we meet people, like they are so fragile to their circumstance, they're so uneducated. But I think the most important thing is to gain their trust and to see their face when they know somebody really cares and somebody's here, somebody understands, somebody gets what they're going through. So their face and their compassion, because they sincerely are very grateful for what we do. So that'll be my favorite part about my job every day.
Ms. Oaks?
So I'm going to have to share both my job's favorite because it wouldn't be fair to my Monday job. So as a nurse practitioner, I work at a wound care, advanced wound care at Sovah. And my favorite thing is giving those patients hope and healing. You wouldn't believe all the people that have wounds and they're ashamed of the wounds. They may smell, they look terrible to them, and they're so afraid. And I love building the trust with them. And we usually can heal wounds in about 14 weeks. And when they leave and they ring that bell, all the nurses and myself, we all cheer them on. So that's what I love about a nurse practitioner, is being able to help people get healthier. There's a whole lot behind there. Now at the university, what I really love, I love working with the students. We have them come in as sophomores in nursing, and they're so afraid. And I love building their trust there too. And I love helping them see that they can do this and what type of work it is going to require. I love seeing seniors when I work in the simulation area. When I have them as sophomores, they're so afraid to talk to the mannequin. And as seniors, oh, they're rocking it. They're so good. And they're getting ready to go out into the big world and probably working with Mr. Bradley. And so that's a really proud moment. And like today, in about an hour, I'm able to advise students. So we are assigned students. And some of my students are not doing so good. But this is going to be a chance where I can, encourage them, and they can get right back on the right track. They have probably, I don't know, about 7 more weeks to finish the semester. So if they crank it, they can turn it around. But if they choose not to, then they don't. But that's what I love, because I get to help all kinds of different people.
Yeah, for me, it's relationships. You build them as a nurse and with your patients and their families and the people that you care for and that they care for. And then as my career has advanced, it's the same thing. It's relationships with leaders and peers and really developing people so that they can take care of bigger and bigger sets of people. You know, um, Karen's lucky. She gets to practice with those patients and step back and really have an influence across a broader scope. And developing leaders has really become something that I'm passionate about. But it all comes back to those relationships. And as you build those, you can be impactful in people's lives. And I know that's a lot of what Jennifer does too in her world. You know, I think about those opportunities that we create for each other by developing those relationships. That's what's really impactful.
Yeah, you're all touching on a very similar passions, you know, relationship development and maintenance, developing trust. So the trust has come up in each one of your comments. So that tells me that each one of you, as a characteristic or a skill that makes you successful, is probably that you are trustworthy, or you're able to convince others that you are trustworthy. I'm curious, what other characteristics or traits do you think that a student would need already to be successful if they were pursuing in the health science field? We can start with Jennifer.
I think the biggest thing is, if you're gonna go in the healthcare field and then you're gonna go into dealing with individual people, and don't take it as just a career. You gotta have compassion, you gotta be willing, you gotta have open-minded when you're dealing with individuals. It's just not a job. It comes, a lot more comes with just dealing with people, because if you go to somebody and what you're doing is you're not compassionate about what you do, you're not gonna put the effort into what needs to be done.
So I think I'm next, right? Okay. So what I find with nursing, you do have to have compassion. You have to have empathy. But to get through school, you have to have grit. And I'm sure some of your teachers, y'all have spoke to your students about grit, and the students, you've probably heard of it. You also have to have perseverance. Times are going to get tough. And we might hit on this topic, but COVID-19 has really, really taken a toll on nursing students. And it's taken a toll on nurses and all healthcare workers. And it's probably taken a toll on some of you students. So another characteristic is you need to know how to take care of yourself. If you cannot take care of yourself, you'll never be able to take care of a patient. And because if you can't take care of yourself and you're not happy with yourself, you will come across kind of mean to the patients. And you don't ever want that. So you have to know, like, when you need a break and you can just step out into the closet. Nurses cry in the closet. They go in the med room and cry. Even before COVID-19, we would do that. But compassion, you know, like if you can put yourself in that family, because you take care of a patient, but it's not just the patient, it's family too. If you can keep the family happy, you're gonna make that patient very happy. So yeah, you really got to have a lot of empathy too.
Yeah, compassion is definitely top of my list too. Karen and Jennifer both hit on it. I think, like Karen said, you have to be compassionate to yourself as well, and care for yourself. Otherwise, you cannot take care of other people. And so, you know, I think the best healthcare providers deliver that compassion. They communicate that compassion, but they're also very humble. It's not about them. When you're delivering healthcare, it's really about the other person. And so you have to have, that has to be part of you. And you have to be able to project that. And you have to be compassionate with yourself and with each other in order to make all that happen. So that is definitely a key trait. And then that integrity, you know, nursing is one of those high integrity fields. You know, you look at any survey, who do you trust in your life? You know, your family, your parents, but right up there is a nurse and a pharmacist repeatedly. You know, these are careers of high levels of trust. So you have to have that integrity to carry yourself through.
Excellent insight. I really like this idea of taking care of yourself. I heard this really great quote the other day. I'm sure most of you have heard this before, but it just really resonates. You can't pour from an empty cup. So you need to take care of yourself if you want to pour into others. So I'm curious, especially with COVID-19 and the pandemic, and you know, just in the field that you're in already is stressful enough, and then we add the pandemic to it. What types of things on a personal level have you done to help manage your own stress, or what tips do you have for students to kind of get out of that headspace of, you know, it feels very crushing being locked down? And anyone can answer.
That's a good one. It's something we deal with every single day. As far as advice, you know, that grit that Karen talked about is definitely important. You do have to be intentional about how you're taking care of yourself. I think that's a key element there. And you have to really believe in yourself too. And I think you know, some of the best. Someone told me early in my career, it was a Henry Ford statement actually, but it was, whether you think you can or you can't, you're right. And so you have to believe in yourself. You have to believe in what you can do. And you know, it starts with that. And even when you're facing those difficult things, you have to choose. Can you do this or can't you? And at the end, it's a very personal question, and you have to answer it truthfully, and then take the appropriate action to do that. So no, it's not easy to deal in times like this. It's been very impactful to nursing. You know, a lot of nurses retired because of this, and you know, the average age of a nurse is my age. They're 48 or 49. Depending on the study. And so that's we need that next generation to help carry us through and take care of us when we get to that stage. So it's important that we have people making that choice to be compassionate to each other and care for one another. So, but it is challenging, especially in this time.
So when we had the lockdown, a lot of things shut down, but healthcare had to keep going. And I have to be honest, I was a little happy that I was still able to go to work and see people, because I'm a very people person. And I think I would have became very depressed just staying at home, because when I wasn't working, that's where I was trying to be safe, stay at home. My family, we used this time to I actually learn more about each other. I have kids who are in college. So I got to know my kids even a little bit more because we were stuck together. And so that was kind of a good thing. But I had to find new activities that I could do. So I started kayaking and joined a group that's in Danville. We go all over the place. I'll tell you what, I've always loved Danville, but it's such a beautiful area. So I feel like taking time for yourself, like Brian said, and doing things outdoor. I mean, you get free endorphins right there, get dopamine release, and it makes you feel good. So like with my students who are struggling, and I see it because, you know, can you imagine being in college and they're like, no visitors in your room, and they can't have all these little activities. Well, I'm like, guys, go outside, enjoy the trails that we have here. And so it's kind of neat. We're located on Bridge Street. I take my students, I teach health assessment. And so we go outside, we walk on Bridge Street on the trail. And while we're walking, we're paying attention to how we each walk. And so we're taking care of our body while we were still doing school. And they will always ask, can we have class outside all the time? But we can't. But it's like, just find time. And also if you're a spiritual person, it was great that church was offered on Zoom. And so just try to stay connected to people if you're a people person. Now, all the introverts, I think they loved it. they'd have to make excuses for not going anywhere. Thank you, Brian.
Yeah, that's me. Totally.
Jennifer, do you have any tips for managing stress? No? Okay, that's all right. So I know the students I can see the questions are coming in. We will be asking some of those student questions soon, but I can guarantee you one of the questions, and this is changing gears just a little bit, but I know that students always want to know a salary range for your positions. So I'm curious if you would be willing to share, and I know that it's a big range because of education in some of your fields, but if you could give us an idea, a general sense of what you know for salary range. We'll start with Miss Canada.
It all depends on, to me, I feel like it all depends on the area you do but right now my salary range is about 33, 34,000 a year, and it's rising. And we ain't even, it's not even being state, this is not even state pay. We are on our own grant funded. So I think that's amazing.
So I want to speak on the nurse educator because Brian would be more knowledgeable about the RNs. So for a nurse educator, believe it or not, y'all, we get paid less than nurses that graduate. And it's pretty disheartening, you know, when you think about that. But this is when you learn you do what you love. And I love education. So how many days did I tell you I work here? Tuesday through Friday. So the average range for a small private university is about 50,000 to maybe 62,000. So when Brian tells you what the RNs make, you're all going to be like, whoa, you're crazy. But you got to have people that care. And, you know, I feel like, I don't know, I just feel like it's my calling to help produce nurses to take care of people. Now, on the other hand, if I was really all about money, nurse practitioner, you can make 100,000 to 150,000. And sometimes my friends are like, you're crazy. Why do you stay in education? Because my salary is like half what I could make. But I stay in what I do because I absolutely love it. And so you guys right now, money's going to talk to you, but it's actually what you love, what you love. And, you know, like COVID-19, we were doing all these vaccinations and volunteering. So when you volunteer, it's free. Well, now they have a big vaccination clinic come in. I just want y'all to know, RNs can make $90 an hour, $90 an hour. And I was like, oh, wow. But I'm teaching, so I couldn't take advantage of that. But I'm going to tell you what, I bet they didn't get the same satisfaction that I had when I was volunteering. And sometimes, and I want you to know, when I volunteered, like all the volunteers, we never had any complaints. People, they cried, you know, they're so happy to get a shot. So it was very rewarding. And I could take my students, and my students could give like over 100 shots in a day. And I mean, you just wouldn't never do that as a nurse. So, but I know I added a little bit more than salary.
Yeah, the rewards are different. It's a different calculus when you're in healthcare. So that's a great point, Karen. And as beneficiary of staff that are dedicated to creating the healthcare workforce, you know, thank you for that dedication. I know a lot of my friends are instructors, and there's a sacrifice there, but that passion really comes through. So to speak about nursing salaries, it's really kind of a wide a wide range. I would say the average nurse that works in acute care probably makes about 70,000 a year, and it goes up from there pretty quickly. You know, with overtime and willingness to work contracts and weekends and stuff like that, you can get to six figures really quickly and easily. Add advanced degrees like nurse practitioners, add leadership, and you're into the 100,000s easy. So I think there's a really wide variety. There's nurses that work less hours. They make a good wage and they don't need to work more, and so they don't. And that's just that's a lifestyle choice. That's a good self-recognition. I can give this much, and the rest of the time I need to take care of my family. I need to take care of myself, however that works. But there's a lot of power in that RN degree, and you can make those choices and really live a good life. And so that's a real advantage to the healthcare field. And there's so much diversity in what you can do, from inpatient work right at someone's bedside when they're the most critically ill. Like I did with trauma, patients coming in and they're just all messed up from an accident, and I'm right there and taking care of them, to end of life at home with somebody in their home as they're passing through the last stages of their life. And it's a one-on-one, very intimate relationship that those nurses share with their patients. So there's a big range in that, in the kind of work, and there's also a big range in the salaries that people choose to make. But those nursing degrees, there's a lot of power. You can choose, however you want to land on that spectrum. And this is a great diverse panel here too.
Yeah, definitely. Thank you. It sounds like there's just such a wide range. I mean, students can take any path and probably end up being in a pretty successful route. So we do have quite a few student questions coming in. So I'm going to switch gears and move over to some of our questions here. We have Rebecca Whitlow. Rebecca has asked, did you take any classes in high school to jumpstart your career? So if any of you have, feel free to answer that question.
I think the most beneficial for me were sciences. I would take every science class you could take to help get you a great foundation. The higher level you can go, the higher the payoff in college as far as science classes go. And that's the foundation from which nursing and all the other health sciences, they really build off. Even the social work, and you have to understand some basic biochemistry to really do a good job at that level. So I would just recommend those science courses in high school and get as far as you can in all those.
I believe that was Rebecca. That's a great question. Students who are part of governor's program, some of them, I've had students graduate high school and they are sophomores here and they go right into nursing school. And I remember my first student, he was from Tunstall, and he was such a cute little guy. You don't call him little guy, because I thought, oh my gosh, this is like my daughter, going to college. How is, he's going to take care of patients like in like 8 weeks, the first semester of nursing school, like halfway through, we're going to the hospital. So anyway, it worked out really well. He had anatomies, he had his English 111, 112, he had his psych, he had sociology. So you don't have to go to governor's school, because some people were in, I forgot the other program they have it. My son was, AET, I think. There, you can pick up math, you can pick up the English again. And I also understand you can, take those courses. You don't have to be in those programs. So like Brian said, anything you can do with science, that's important, because one of the questions he asked, like a characteristic, and we were all talking about the nurturing, the caring, and all that lovey-dovey good stuff. But the other thing is, we are scientists and we got to figure things out. So we are super smart. People think we're just nurses or something like that, but we're actually scientists, and we identify problems where we then have to call the doctor, and I'm speaking as an RN, and say, hey, this is happening. And the nurse really knows what's getting ready to happen. They have to take the order from the provider, like a doctor or a nurse practitioner. So like Brian said, if you can take any of these courses in high school, that will help you a whole lot.
Thank you. Joshua White, we actually answered this. Joshua White asked, can you still be a nurse while doing high school? So Karen, you had already touched on that. Is there a minimum age requirement if a student was doing, let's say, an internship at in the health field? Are you familiar with age requirements?
So when you're in nursing school, you basically are going to do that after your second year of, it depends what the internship is, but usually, so now in high school, you have students being CNAs, but to be able to be in a nursing program, you have to graduate from high school. And so yeah, so you do have to graduate. Now, I have had students that were 17 years old because, they graduated early. If there is an age, I don't think the Virginia Board of Nursing has identified that.
It's more with a diploma than the age or the
Yeah.
GED or,
Yeah.
okay, that makes sense. Addie Carney asks, what are some careers you would suggest for someone who wants to work with people's mental health?
Great question. There is a field in nursing to work with patients with behavioral health disorders. We rely on a lot of other allied health career support. So social workers are definitely valued. I mean, psychiatry, psychology, those are the kinds of fields. I bet Jennifer's got some wisdom to share with us on that.
Being a certified community health, we deal with mental health every day, like breakdowns we'll go as far as we can go until we send them off to the Harrison Street to see a psychology, or we have to have them put away, even to drug abuse. So we deal with mental health every day.
Are there any certifications that you get while you're a community health worker, or that you look into getting requirements?
Well, we try to get as much as we can. Anything we can put on our belt as a certified community health worker, we do so to use as tools when we work with people. So we do everything. We do all the classes over at DPCS. So when they have mental health one-on-one with children, adults, drug abuse, opioid, and all that good stuff, we take everything we can to put on our belt. So we know how to deal with people, so we can identify the signs, so we can point them to the right direction.
My take on the mental health, boy, it's such a huge need everywhere. And actually just about everyone has some little bit of mental health going on. And if you don't know, you will find out later, because it's just common. And it's also a thing that people don't talk about. In our area, we do not have a lot of psychiatrists, psychology. People have to go out of town or they actually suffer. So one thing, nurses, they can specialize in, we have something called integrative health, and they get a minor in the psych. And I really push that with my students, because not only does that help them, they'll be able to help patients and families. And then Averett University, I believe in probably a year, we'll be starting a nurse practitioner psychiatry. And so it'll be a FMP who can specialize in psychology. And I noticed there was one person, I think she started at GoDoc, and I was really excited to see that she has that postmaster. So she's a nurse practitioner, and now she can specialize in psychology. And I bet she's going to get a lot of business. This area, it really, really need it. So if any of y'all think like, oh, I want to do that, you can go to any college, get your bachelor's degree in nursing, and go ahead into a nurse practitioner program and focus in that. Just to put it out here, health education, you can get a lot of this paid for. Sometimes employers will pay half of your loans, or you work there so long. For the psych MP that I'm telling you about, in Virginia, I don't know what the program is, but I could go for free, but I'm like, no, I can't do any more school. When I finish the doctorate, I'm done. And it takes a special call into to work with that. But so on the nurse side, that's what I know about that part.
Sounds like there's a lot of opportunity in the area for not only building the career awareness, but also building the careers themselves in this area. We have time for one more question. Joanna, I'm sorry, Nyamboga, I'm not really sure how to say your last name. Do you like being in the health career, and have you ever just thought about doing something else when you're feeling stressed out at work? So if you could answer very briefly, just have you thought about doing something else? And if so, what would that be? We'll start with Jennifer.
Yes. We get attached easily to our clients and we get emotional. So I think it's a roller coaster for us. So I always thought about going ahead to get my nursing, my degree in nursing. So, but I look at it as this, like, I still have to deal with the same situation. But instead of going to people's homes every day and dealing with them on a daily basis, I've been in the hospital. But yeah, I thought about it. It gets very emotional. So, cause you understand when people go through it, and when you really can't help them, it's like it does a lot to us. We'll come in the office and we'll cry or we'll vent to each other, but it does a lot to you. So yeah, I've thought about doing something else where I don't have to deal with people, but somebody had to deal with me one day.
I've been in healthcare my entire adult life. I can't imagine doing anything else, but I would say that when I've gotten to a point where I knew I was taking more than I was given, then you pivot and you do something a little bit different. You stay in the field, and I've been able to do that. I've had a long and successful career just pivoting and doing many different things. If I gave you details on everything I've done in nursing, you'd be like, wow, you've worked in all these different areas, and that's really what kept me going. So that is another advantage to a healthcare career. You can really get into some different things. There's common themes, don't get me wrong, but there's definitely different flavors out there that you can try.
So I do love what I do. Sometimes, you're like, oh my gosh. So on Mondays, you have to make sure you chart perfectly and charge right, because they do chart reviews and it'll come back to you. And I do not like having anything come back to me. So I'll try to do it just right. And so what would I want to do? I would love to own my own business. And here again, you can tell I'm not a money maker. I would like to provide health care for people, and because some people, they have insurance but they can't afford health care. We used to have a free clinic and we don't have that anymore, so that's always in the back of my mind. And then as a nurse educator, sometimes I do get stressed out, and I'm sure teachers out there, it's the same thing. Your students won't do what you ask of them, and they can do better. And sometimes I'm like, oh, is it worth the little bit of money? And then all I have to do is go home and think, yes, it's worth it. So.
Well, that's fantastic. Thank you all so much for all the work that you do on a day-to-day basis. Our world functions because of people like you, and we all stay healthy because of people like you. So thank you so much. And thank you to our students and our classrooms that are all involved today. We appreciate you coming to our Career Choice Expo and listening and asking such great questions. There were so many questions we weren't able to get to all of them. So, we'll do the best we can to follow up. And I'll hand this over now to our Career Choice staff.
Can you see my screen, Dana? You can?
Yes.
Okay. Thank you, Dana, and thank you to all of our panelists for sharing your knowledge and experience with us today. For our student attendees, we hope you are energized and excited to research opportunities in the health science career cluster. The Career Choice website is a great place for you to start. We will be drawing the gift card recipient name in the upcoming week after we have had the chance to follow up with your teacher and whole class registrations. The gift card recipient will be contacted through their school. You can provide yourself with another opportunity to win a $50 Visa gift card by completing the Career Choice Scavenger Hunt that is found on the Career Choice website. And the Career Choice Survey will be coming March 22nd. Each student completing both activities will be entered into a drawing for their school. Good luck to each of you, and we hope you will continue to take opportunities to imagine your potential, connect with employers, and explore your career possibilities. Thank you all.